Many thanks for staying with us. You're still watching Good Morning Namibia. Now, with rising cases and low awareness, Namibia is stepping up with its first ever prostate conference taking place from the 15th till the 17th of May 2025 at the UNAM School of Medicine, or the Hage G Geingob Campus, if you will, here in Windhoek. Now, this landmark event will bring together experts to promote early detection, share the latest research findings, and raise public awareness on prostate health. And joining us to talk more about the conference and also the state of prostate health in Namibia and why it matters are Dr. Hagen Fortsh, Head of Urology at the Ministry of Health and Social Services, as well as Mr. Lukas Neidlein from the German Cancer Research Center. Gentlemen, a very good morning to you and welcome to Good Morning Namibia. It is good to have you here with us, yes.
Thank you for having us here.
Good. I think a good place to start with would be perhaps to understand what prompted this idea to have the first ever prostate conference. I know prostate cancer has been a topical matter in Namibia for a while, but really drove us to the point of having a conference around this matter. Perhaps we can start with you, Mr. Lukas.
Yeah, I think on the medical side, what Dr. Fortsh is going to elaborate a little bit more. Well, cancer is a global problem, right?
Absolutely.
And we have a strong relationship, the German Cancer Research Center, where I work together with UNAM University here and the Ministry of Health and Social Services.
Yes.
So for us, it was clear once the interest was rising of prostate cancer, let's do something together, because as I said, cancer is a global problem and it doesn't know any borders. And this is why we're here today and we're having our first summit in Namibia.
Fantastic. Doc, a long overdue summit, would you say?
Yeah, it is an opportunity to make the community aware of this problem, because it's an avalanche coming down on us, and the sooner we can act on it and maybe even take steps to prevent it, the better.
Very much.
Yeah.
The use of the word avalanche may be a bit scary to some of us, but you know,
it's the truth.
Yep. Let's talk about some of the perhaps the contributing factors as to where we find ourselves as a country. Where have we done well? Where have we been lacking? And how can we improve on those here?
I think the average income for the Namibian and the Namibian male in this context has improved. The access to rich, delicious, oily, fatty food. Our meat is the best that you can imagine, but it's loaded with fat. It's unhealthy. The oil, the fat, the sugar and the salt. Those foods, they all impair our health. And in prostate cancer, it's the fat that is the biggest culprit, just like with colon and breast cancer. And that the fast foods that are readily accessible, me being a German-speaking Namibian, our German cold meats, we love them, we are proud of them, but they are not healthy.
They're not healthy,
Yeah, it's for special occasions.
And I know we've really been trying to drive the message across, you know, from the Ministry of Health's perspective, from that of the private sector. Has the message been getting across, Doc?
It's an ongoing project. We are trying very hard. Also, the Cancer Association is really doing a great job on that front. You know, we males, we like to be autonomous, and we have a totally different healthcare seeking behavior than a female. You know, we delay until we can't go on anymore. And that is probably contributing to a large extent to our reduced life expectancy compared to our female compatriots.
Very much. Mr. Lukas, let's talk about where the German Cancer Research Center, of course, falls within this picture, and the work that you've been doing here in the country, and perhaps some of your findings as a research institute here.
Yeah, thank you. Yeah, as Dr. Fortsh said, I think this is also important. It is a male problem, right? This is not a Namibian problem. This is not a Southern African country problem. This is what we're also facing in Germany. Yeah, it's the males who think, I'm not sick, I don't need to go to preventative measures. So so also we have an interest in it on rising awareness to help in this situation. The German Cancer Research Center comes in because we have, as I said, this partnership. We have this interest, and also this is a big thank you to our sponsors, who is Bayer and Siemens Health Engineers. So they're supporting us with this funding. Since we're a national institute, our funds are very limited for international work. So therefore, we're very thankful that they are supporting us on this summit.
Very much. And of course, essentially, what would this summit look like? You know, it's a first of its kind. I'm sure there's a lot of work, a lot of thought that went into it, looking at the approach of this summit, looking at the subjects that you're going to be unpacking, etc. Talk to us about the work that's gone into the summit so far.
Well, so far I think I've seen a lot of copy shops in Windhoek because this is something I'm recently doing. We're raising awareness not just in formats like this, but also like hanging up posters. So my work is very from A to Z. It is supporting our doctors, it is supporting our program, it is supporting our sponsors, it is taking a little bit over sometimes also the wheel and saying like we really have to get this done now. I mean the summit is very, very soon, but yeah, for me it is also a wonderful experience. It is a great chance to get the country and the people to know. So I'm very happy I'm here and supporting that project.
Absolutely. Dr. Fortsh, what are you looking forward to as part of this summit?
I do, yeah. It's a fantastic opportunity to put prostate cancer on the map for the country. And also to exchange with other Southern African countries knowledge and experience, and to improve cancer management and access to treatment. It's a very unique experience probably waiting for us.
Absolutely. What are we looking at as far as attendance is concerned for the summit, for this conference here?
I think it's impressive to see how the participants are rising up. Like this is also helpful that we're like taking formats like this. And yeah, as Dr. Fortsh said, this is not just a local, I mean, it's great. We have all the local expertise. We have the doctors from here. We have people from this region. But on top of that, we also have people coming from the UK. We have the best experts coming from Australia even. So I think this is really raising the awareness as well of seeing like, wow, this is something we're all in together. And yeah, I can just tell everyone, please join our summit. This is going to be a great chance and a opportunity.
Beyond the summit, of course, comes the real work. I think what is some of the more immediate deliverables that you'll be looking at, some of the approaches after the conference? Talk to us about that here.
Yeah. I think for now it's a little bit unclear to say. I think this is also something we're going to find out during the summit, but there will be actions and there will be readouts afterwards because we want this to be a sustainable measure for all of the participants. And I mean, we have great players within it, so I think this is going to be a great chance and we will find good solutions that will be long-lasting and will support us further.
Very much indeed. Doc, I know as a ministry, this weighs heavily on the ministry as well, with very limited funding, with very limited resources already. As the head of the urology department, talk to us about just how much of a bearing, how much weight the issue of prostate cancer applies to the public health system.
You know, the prostate cancer disease itself is, for us in this public sector, always to manage advanced disease, which is a pity, which is often leading to unnecessary suffering and trauma also to the family that has to observe the suffering. And our treatment modalities have improved in the decades that I've been in the service. But there are limitations in the management of options open to the patients. The staging that has to happen is expensive, and it makes it for us difficult to speedily get the patients through the conveyor belt of the numbers that we are confronted with. Sometimes it's so advanced that it is not rocket science to identify what needs to be done. But sometimes, you know, you want to offer curative treatment, and then you have to have your ducks in a row to offer the patient this option. And in the public sector, that is a challenge. It's a truth,
Doc, you mentioned, of course, men's reluctance to seek health and medical advice, to go for regular screenings, to go for regular checkups. the issue of stigma around, prostate cancer, the examination methods thereof, etc., have often been a deterring factor for man to seek health. The same with, if you look at colonoscopy, etc. What advancements have we made as far as, understanding prostate cancer, testing for it, etc., that have perhaps made it a bit more easier, a bit more accommodative for men to show up at health practices?
Yes. The first is, if you have a family history, then for heaven's sake, do not delay, all right? Yeah. When you are 35, do your blood test. Just do the blood test. You should know your HIV status. You should know your PSA.
Yes.
All right? If you do it on an annual basis, we'll pick up the disease early. That blood test is probably the best cancer biomarker in human biology. True. All right?
True.
So that blood test is easily done. It's accessible. Again, the Cancer Association also offers the screening, so you don't have to sit in a queue in a clinic and ask them to have this blood test done. But at least know your value. For the decade of 40 to 50, for people without a cancer history in their family, prostate cancer history, they should do 3 blood tests that should all be in a favorable range. Comes age 50, if you want to stick with the blood test, by all means, but do it annually.
Yes.
And keep your eye on it. Just like you're a health professional that provides care to you, and you will pick up the curable cancer early in time, before you develop symptoms. Because by the time you develop symptoms,
it's too late. Often.
If it is cancer, it's late. If it's not cancer, which is 5 out of 6 cases, then it's you drink too much coffee, or you drink too much fluid, or your sugar is out of control, or things like that. 1 out of 6, it's cancer. Don't fool around with it. If you develop symptoms in the last year, go to your health professional. Get yourself checked. Don't fool around, because there is a sea of suffering in front of you.
Absolutely.
Yeah.
What are some of those early symptoms, Doc, that we should look out for?
You use the word early again. It's late. Once you are symptomatic, it's late. But getting up at night more than before. Hesitancy to get started, interruption of the stream, having to rush, that it burns while you have a leak, dribbling afterwards. We men know all what we are talking about. But if it gets worse, you should wonder, why is this happening? I mean, to drink too much caffeinated beverages, often it's a massive improvement if you stop the caffeine. We know that caffeine reduces your brain circulation by 20%. So why do this to your brain? Drink decaffeinated coffee or rooibos tea or whatever.
I'm guilty of that, Doc.
You see, to be on this ungodly hour on duty, it's a challenge. No, it's understandable. But caffeinated drinks often relieve symptoms dramatically. But that is in the absence of cancer. And if it doesn't, then cancer is even more likely.
Very much indeed. Mr. Neidlein, of course, just in conclusion, as far as this first ever summit is concerned, once again, how can the public form part of it? I know it's a very specialized summit, of course. A lot of health experts is going to be forming part of this. Perhaps if you've made avenues for the public to form part of it, maybe you can talk to us about that. But also just lastly, a word of encouragement as to the importance of this summit, of this conference, and really underscoring, prostate cancer as a health issue in this country.
Yes. Well, I think the summit is for everyone. It is for everyone who wants to join us. I mean, if you look on our website, if you look at our program, we do have great experts talking about medical aspects, but we have also people who survived from prostate cancer that are talking to you, and they're going to tell you what a doctor is telling you, right, what you shouldn't do, and they tell you, well, I have been there, and my family suffered, and I suffered, so this is really something we can connect with these people. And if everyone goes out after this summit, every local who's not in medical area, and thinks, maybe I should get my blood tested, right? then this summit is already a massive success. And this is what I'm really looking forward to it. So I can just encourage everyone, neither medical person, neither the person that works in the bakery, people like me, everyone, come to our summit, join this diverse panel, all the experts, and make the best for you and your health, and also therefore for your country.
Wonderful, thank you. Doc, just in conclusion, of course, as a ministry, what do you hope are some of the outcomes from this meeting? And of course, how do you hope to utilize some of the outcomes from this meeting as well, from the summit as well?
For us, it's to see more curable cancers and less advanced cancers that we do somewhat mutilating surgery on, that is really very effective in that situation. But no man wants to undergo this type of surgery. But if you have back pain at night that you can't sleep, it's not your back from bending or breaking a disc or something. It's metastases. You want to sleep and you cannot sleep because the pain keeps you awake. It's terrible. And then this type of surgery relieves the pain. The next night the people sleep properly again. And that, for our ministry, the more curative treatment we can offer, the more work there is for us to do. But the service to the patient will be improved, and they will have a life after the treatment that would otherwise have been denied to them.
A very costly treatment for that matter as well.
It could be. There's a magnetic resonance imaging device in the pipeline now that the School of Medicine has is going to establish at least. That will help us a lot, because currently that type of service is for very limited cases only, especially neurological injuries and so on. And at great expense to the ministry. And if it is more accessible, our standard of care will improve dramatically.
Thank you so much for being with us this morning. Thank you for sharing some insights on the state of prostate cancer in the country. Thank you for coming up with this summit, with this conference. We look forward to it. We look forward to the outcomes of this conference, and of course addressing this huge health problem in Namibia. Thank you.
Thank you very much.
They have it. Dr. Hagen Fortsh, he's the head of urology at the Ministry of Health and Social Services, as well as Lukas Neidlein, who is the German Cancer Research Center, from the German Cancer Research Center, talking to us this morning about the First Ever Prostate Conference, the Southern African Prostate Cancer Summit 2025. Of course, a major event bringing together key stakeholders, not only from Namibia, but from abroad as well, taking place from the 15th till the 17th of May 2025, right here in Windhoek at the UNAM School of Medicine campus, the Geingob Campus, and they, of course, look to address and place the issue of prostate cancer under the spotlight.